Hi, I'm Marin.
And I'm Justin.
Today we're going to talk to you about Narcan and how to use it. Narcan is used to reverse opioid overdoses and opioid overdoses only. What are some signs of an overdose?
An overdose can be some of many different things, but the main thing is a person being unresponsive. So that person can be laying there, arms limp, not responding, and the big thing is they are not breathing. And so some people can be looking like they're turning blue, but if you have darker skin, it can look like you're washed out.
What are some signs?
What are some risks that could put a person in an overdose?
So a few things that might put someone at higher risk of an overdose is actually having been sober for a really long time. Often, if someone uses for the first time in a while, they might use the same amount they used way back when, but have a different tolerance, and so they're kind of at higher risk for overdose there. A really common cause of overdose is people taking prescription medication, having forgotten they'd taken their prescription that day, and then taking it again. Another thing that can put someone at higher risk is mixing substances. So substances talk to each other in your body and have different reactions. So those are some of the different things that might put someone at higher risk. First thing you're going to want to do if you think someone's overdosing is try to wake them up. Verbalize everything you're doing and narrate, right? If you see someone who's unresponsive or you feel like isn't breathing, start talking, right? Hey, I'm concerned about you. I'm walking closer. Hey, you're really not waking up. If you can hear me, can you speak back? If they continue to be unresponsive, you're gonna do something called a sternum rub. So if you take your hand like this, use your knuckles, this is your sternum, you're gonna give it a pretty hard rub. It hurts enough that if you're just not enough, you're gonna come to, become alert, but it doesn't cause any long-term damage. And again, remember to narrate what you're doing. Even if that person's unresponsive, they might be able to hear you, they might be processing some of that information, even if they can't speak. So just say like, hey, I'm trying to wake you up, I'm gonna touch your chest and try and wake you up that way. If they continue to not wake up, next up is administer Narcan.
So each of these boxes of Narcan, there are 2 doses of Narcan right here. It fits inside the palm of your hand. The white part goes into the nose and the red part goes on your finger. You're going to put it into the nose. It doesn't matter if it's all the way in, it just has to be into the nose. You're going to push down that plunger and it's going to administer the Narcan into the nose.
Even if someone's not breathing in that moment, the Narcan will still diffuse through the nasal membranes and get into their body. Narcan's really cool and does one thing and one thing only, which is kick opiates off of the receptors in your body so that your brain can tell your body to breathe again. Once you administer Narcan for that first dose, you're going to wait about 2 to 3 minutes to see if they wake up. If that person doesn't wake up in that 2-minute window, you're going to want to give them another dose. In that 2-minute window, it's also a good time to call 911 and get paramedics on their way with more doses of Narcan. A recommended script that we use in Butte County, when you call 911, just say, hey, someone's not breathing, I need a paramedic. You're not a medical professional in that moment, so just being clear as they ask follow-up questions, don't make assumptions about what's going on. Just continue to repeat, I don't know what happens, someone's not breathing, I need a paramedic. And that's shown to get paramedics there fastest in Butte County. A couple things once they wake up. What's gonna happen there?
When a person comes back from an overdose, they're going to be really disoriented because they aren't going to entirely know what had happened. And so the best thing to do is for you to stay as calm as possible and narrate that to them and say, hey, I noticed this, I gave you some Narcan, and just try to talk them through it. They might be a little angry, they might be disoriented, but the best thing to do is for you to stay calm and try to make the situation as positive as possible.
Someone's going to want to stay with that person, whether it's you or someone else, for at least 2 hours after administering Narcan. Opiates have a half-life, so as the Narcan begins to wear off, they might slip back into an overdose. They may also vomit, and you want to make sure they don't choke on that. If they use again in that window, they'll likely slip right back into an overdose. So it's really important that someone stays with them or they go with the paramedics for at least 2 hours. Another option throughout this process is while you're waiting in those 2 minutes, you can administer rescue breathing if you're safe and comfortable with that person to help get oxygen flowing through their body again. That's all we got for you. Thank you for listening.